my name is Doris St. Louis, and I'm a respiratory care student at Miami-Dade College. And the reason I'm here today is to do a how-to video on trach care. Now, the first thing you need to know are the indications and the contraindications. You'll need to know who received trach care. Any patient with a trach or a stoma attack will receive trach care. There isn't any contraindication for trach care. However, hypoxemia is a hazard, and that is when a patient's been removed from a mechanical ventilator. Now, the next thing you need to check is your physician's order. You need to know if this patient is requiring trach care. Now, you have to have all your necessary equipment in order to perform a trach care. You need your tracheostomy clean and care tray. You need your Velcro necktie. And you also need your sterile gloves. But before I get started, I'm just going to step over here and wash my hands and don the proper PPE. Now, the first thing you like to do is introduce yourself to the patient. Hello, my name is Doris St. Louis, and the reason I'm here today is to do a trach cleaning. Once you've done that, you check your patient for their medical identifier. You need to check their medical record number and their date of birth. Also, assess your patients for their vitals and their breath sounds. Now you're ready to set up your sterile field. I'm just going to place my tracheostomy necktie over here so that it doesn't get in contact with my sterile field. Now, in my kit, I have this sheet here, and you just want to make sure you handle it from the outside because I'm going to be creating a sterile field. Now, I don't want anything to contaminate it. And everything inside my tray, I will just dump it onto the sterile field. And make sure not to throw the tray away because you'll be needing it for cleaning. Now, I'm just going to don the proper PPE. And remember to handle it from the outside. With the gloves, you can handle it on this side, making sure not to touch the sterile portion. So right now, I'm just dressing my non-dominant hand with my dominant hand. Making sure not to touch the sterile portion of it. And with this glove, sterile can touch sterile, so I will go from underneath the cuff. Now the first thing I'm going to do is I have this sterile water here, and as well I have the hydrogen peroxide. Now I'm just going to pour the sterile water into all three compartments. And with the hydrogen peroxide, I'm just going to pour it into the saline water solution. And that portion will be used for cleaning. Now, the first thing I'm going to do is remove the gauze from the patient. And I can throw this portion away. Now, here I have 3 4x4 gauzes, and I also have 2 cotton applicators. I'll take my first gauze, and I will dip it into the peroxide in saline water solution, squeeze out the excess water, and I'll begin by cleaning around the patient's tracheostomy tube, which is the patient's flange. I also clean around the patient's neck, just in case there are any gunk or anything that accumulated around it. And I throw this away. And with the inner cannula, I just remove it and I place it inside of the sterile water and peroxide solution, let it sit for a while. And now I have my cotton applicator. I'm just going to dip it in the solution as well. And I'm just going to wash around it just in case there was any crevices or anything that I wasn't able to get into. Making sure not to go inside of the tracheostomy tube or inside of the patient's stoma so that I don't introduce any bacteria to the lung. And I throw this away as well. I can follow with this cotton applicator. I'll dip it into the water solution, the saline water, and I could clean around it. And I dip it one more time into the second compartment of the saline water. And I continue to clean around it with the water, rinsing off the peroxide so that the patient doesn't have any skin breakdown. And I discarded that as well. And now I can remove my inner cannula. I let it sit for a little bit so that it can dissolve any type of mucus that's on there. And I'll just clean the inside of it. Clean around it. And now I'll dip it into the saline water solution. Shake. Dip it into the second water. Shake. And I sit it down on this gauze so it can dry. Now I'm just going to make sure everything's all clean and I'll follow up with this gauze into the saline water. Just want to clean around the patient. And like I said, it's to prevent any breakdown. And I dip it in the last one and I squeeze out excess water and I clean it again. And I throw this away. So now my inner cannula should be dry and I can place it back into the patient. And make sure you turn it until it locks. Now, I have my Velcro necktie that I have to place in there. What I do is I remove one portion, holding on, making sure that it doesn't come off. And at the same time, I have my second gauze to replace it. I can cuff the gauze underneath it, making sure not to pull out the trachea or pull hard on it. You wouldn't want to cause any trauma. And also make sure your pilot valve is hanging outside and not underneath it. And I just bring it around the patient's neck. I can remove this portion of it. Place the old necktie here. Drip it around this side. It's going to go around here so you can have a better view. making sure everything's intact. Make sure that the Velcro doesn't catch on to the gauze so there doesn't be any discomfort. Now once everything is done, I ask the patient, is there anything that I could do for the patient to make the patient is the patient have any discomfort? And also, I assess the patient's vitals and breath sounds once more prior to completing. And if the patient is okay and everything's ready to go, I necessarily just pack up everything. Pack up all the equipment. Discard of it. Make sure I remove my gloves. And wash my hands prior to leaving the room. For 15 seconds. And that was my how-to video on trach care. Thank you for watching.